So to talk more about the newly passed so-called Big Beautiful Bill and its impacts to health care and Medicaid, we are joined now by CEO of Essentia Health, Dr. David Herman. Thank you for joining us.
Nice to be with you, Dan.
Again, the so-called Big Beautiful Bill, according to the CBO, it's going to push an estimated 12 million low-income people off of their health insurance over the next decade. And again, that's according to the Congressional Budget Office. What do the Medicaid cuts mean for Essentia and the health care that you provide there at the hospital?
Well, thank you very much for asking, Dan. First of all, what we will see is that this disproportionately affects rural areas. And we have the privilege at Essentia Health. Our service area is about 84% rural. And so I don't think there's anyone that disagrees that there will be a disproportionate effect on rural areas. About over 20% of the people that we have privilege to care for are on Medicaid. About 40% of children in America on Medicaid, and 60% of nursing home residents are currently on Medicaid. What we will see with that is challenges for those people to apply for eligibility. We will see work requirements for those under the age of 65, and proving that you're eligible may be an administrative burden to many of these people. If you're on the exchange, meaning if you have MinCare, what you may find out is that you have to pay the full bill before you get the subsidy. The state has about 90 days to validate that you're eligible for that. It used to be that you could get the lower rate from day one. Now you do not get the lower rate until the state verifies your eligibility. So what we will see, Dan, it's going to affect all of us. Just because people lose coverage doesn't mean that they're not ill. They will likely show up in our emergency rooms. I'm sure they will. They will show up at a higher level of illness than they have in the past. What we are likely to see is longer waits for care. In some areas, you may actually see reductions in care, reductions in clinic. We're going to do everything we can at Essentia Health to make sure that that doesn't happen. Yet, we're liable for the same economic pressures that everyone else is. So navigating this over the next several years is going to be a challenge for several different reasons. There's many different dates into which some of these requirements apply. Some will be pushed out, some happen tomorrow. As a matter of fact, Dan, right now we're working our way through that bill, trying to navigate our way to see what we can do to mitigate some of these impacts.
Okay, a lot of healthcare costs coming, like you say, for a lot of people, but obviously everyone needs healthcare regardless of whether they have insurance. How do you plan to manage those costs? Does providing that healthcare for more uninsured people mean those costs could increase substantially for those who are insured?
Yes, that's definitely what will happen. People will still need the care. That care will still need to be paid for, whether it's the nurse, the physician, or the medications that are used to care for that patient. But there will be no source of funds to pay for that. So what we will see is the cost for that will need to be shifted to others who are paying for that care. They can't be shifted to Medicaid by law. They can't be shifted to Medicare by law. So these costs will be shifted to those of us that have commercial insurance, challenging the affordability of commercial insurance going forward as well.
Like you said, major impacts for everyone in the healthcare system, the insured, the uninsured, and so forth. I'm curious, did you or anyone else on behalf of Essentia reach out to our local lawmakers raising some of these concerns before the bill was passed?
We certainly did, Dan. We reached out to our senators. We reached out to Representative Stauber. We just wanted to make them aware of the impacts that would happen to their constituents as these bills work their way through.
And what did you hear from those local congressmen when you shared those concerns?
They were certainly willing to listen, but we're not sure exactly what impact, if any, our conversations had on the final bill that finally came out.
Okay, we'll be talking a lot with those congressmen about this bill and how it's going to pertain to health care moving forward.